Ms. Kuchai, do children snore and why?
They do. They snore frequently, actually, and the reasons can be multiple. One of the most common reasons to snore, I always explain to parents, is actually due to infections, when they get sniffles, coughs, colds, and their nose becomes more congested. And they find that they often come to us saying that the frequency of the infections is resulting in a lot of snoring. But the other cause for snoring, which concerns the doctors a little bit more, is if the snoring is perpetual, happens outside infections, and also causes what we call sleep disordered breathing. That's when breathing can look like it stops, and parents often awake to the fact that the child may not be breathing adequately. This can be sometimes picked up by the parents, but not always, and it may just result in the child being quite tired during the day. So it's quite often that they'll come back to you saying that I think my son or daughter aren't sleeping very well, they're appearing to be quite exhausted during the day, they're waking up tired and irritable, so there could be other issues around the sleep pattern. The causes for snoring can therefore result in us looking at not only when and how it happens, but also whether it is related to things like adenoids and tonsils, and a lot of parents might have heard of this. And that is a physical blockage at the back of the mouth and the nose that results in the child not breathing properly. If that is the case, we could assess the quality of sleep that they have. It may be that they're a growing age, that things are spontaneously improving, which happens in most of the children, but sometimes it does mean that we have to consider surgery. But these are assessed very carefully, and we discuss each and individual case for itself. Occasionally we also find that things like allergy could also affect the nasal pathway and may cause breathing difficulties, in particular around the seasonal changes such as the spring and summer months. So a variety of causes can be resulting in the child having snoring problems.
Okay, and it happens at any age in childhood, childhood?
So most children tend to snore early on. But as they grow towards 4 to 5 years of age, things can spatially improve. That means that the space at the back of the nose and the back of the mouth are enlarging disproportionately to the size of the blockage. And so naturally from the age of about 5 to 8, things can continue to improve. So that we normally wait for that progression. But if there is an acute problem, or even a problem that's chronic but severe, then we'd have to reassess.
And what could be the long term? So if they snore, does it mean also they breathe through their mouths?
It does. So what often happens is parents say to us that when they've observed their child breathing, that they're often mouth breathing because it's just not possible for them to get enough air through their nose. Now in childhood, in baby neonatal stages, this is often the case, this is normal. But as things grow and the space in the nose improves, adenoids tend to shrink, we find that this happens less and less so. However, we also look at things like allergies that may be contributing to nasal congestion as well, and therefore mouth breathing might be a real problem. But identifying the real severity versus the mild causes, whether we can give nasal sprays that could help ease the congestion, are all options as they grow.
So there's a little bit of watch and wait.
Absolutely, absolutely.
And monitor them to see if they grow
Absolutely, because sometimes the parents will come with a real categoric story of significant sleep disordered breathing. That is that the child is waking up in the night several times, they're unable to catch their breath, they're constantly mouth breathing with their head extended backwards. And we say it's sleeping in a swallowing the sword position, which is not unusual. And we look at all of these parameters to see if any of these add up and if they all together mean that the sleep pattern's not good. Nowadays, often parents will bring a video, and that kind of identifies and helps me in making the diagnosis.
And in what proportion of cases do you need to actually have a surgical intervention?
Depends on the age, to be honest. There is no exact framework for any specific age, but it really depends on the other factors that cause it. So it'd be difficult to say a percentage based on the overall number of children. But under 5s, we have a very low rate of operating if it is outside infection, within infection. Outside infection, there's a higher rate of operating because we know that inflammation is not the only cause.
Ms. Kuchai, thank you very much.
Thank you.